Well, we'll now move quickly to bring on our next guest, Dr. Mohammed Habeebu, the Chief Clinical Coordinator at NSIA Luth Cancer Center, as we track developments around this year's commemoration of World Cancer Day. For 2 years in a row, the all-encompassing theme of this crucial day has been Close the Cancer Gap. 2024 marks the third and final year of that campaign, with the message now switched to Together, we challenge those in power. Good morning, Dr. Habeebu. Good to have you join us.
Good morning.
On the morning show.
Good morning. Thank you.
All right. It's another World Cancer Day. Has anything changed? I know that this is the third year of the Close the Cancer Gap campaign, but this year, are we speaking to those in power, and what's the language that we're using in speaking to them?
Well, we are speaking to those in power, and we are trying to emphasize the need for coverage, health coverage, so that we can have better health system, so we can also have awareness, good awareness about knowledge of cancer and how to achieve a good, outcome with cancer treatment. And that goes to, emphasize the need for screening, emphasize the need to have adequate facilities, adequate personnel, so we can have a better outcome with cancer treatment for our populace.
The theme, close the care gap. I mean, cancer does not respect anyone, not age, not religion, not race.
Yeah.
I mean, people, say cancer is a death sentence as much. I mean, that narrative is changing because of the care that has been introduced so far. But, affected victims have been advocating for affordable healthcare in Nigeria. I know that there are some policies in place already. I mean, there's a 2012 policy which, helps, in terms of palliative care, even screening and all of that. What more can the government do to close the care gap?
Yeah, in addition, there is a program called CAP program, which the government has introduced to reduce the cost of accessing cancer treatment. And more importantly, we are having, they are equipping many, cancer treatment centers across the country. For example, where I work, NSIA Luth Cancer Center is very equipped. Is the most equipped cancer center so far in sub-Saharan Africa, apart from South Africa. So in West Africa, we have the most equipped center with 4 machines, and the machines can go on to do artificial intelligence treatment. And we have also in that center facility for the indigent. So far, that's the only center I know that also sponsor cancer treatment for the indigent. And we have been seeing patients all across the globe. We have Nigerians coming from overseas to come and access the centers. And we have programs, collaborative program with centers above, the well-known centers in the West, so we can have standard treatment, state-of-the-art treatment, which is comparable to any center in the world. We also advocate that government should improve on health insurance for cancer treatment, because cancer treatment is so far one of the most expensive when it comes to medical treatment. And we know that the economic power, the financial power in the country is falling day by day as a result of, Naira that is falling. And we know that we have more of peasants than, the higher class in this part of the world. So to access treatment, we need insurance. We need to take from, money from everyone, little, and use it to serve those that really need it. After all, we all have car insurance, and I think we as humans, we are far more important than cars. If you are enforcing car insurance, I don't see why we are not enforcing health insurance. We should be able to enforce health insurance so we can have access, care.
Does any health insurance in Nigeria of today cover cancer? Yeah,
there are some health insurance that cover cancer. The only thing is that not everything about cancer. Most of the time, they to some extent, I don't want to mention name, but it's far too little. It's not significant, because at the end of the day, you see that even those that have this coverage are people that can afford it. It's not the people that really need it. So we need the one that will be general. We don't want, it's not just those that for the elite, because those ones that we have are usually, being practiced by the elite. We want that for the general masses who cannot really afford it, not for those who already can afford it. Yeah.
You've spoken about what, the government can do in terms of insurance, but what can people do? As Oji said earlier, cancer doesn't respect, who you are, your age, your gender, where you come from. And there's so many different forms of cancer that affect people. But are there any behavioral changes that you're trying to push? Yes.
Behavioral changes, more importantly, screening. Cancer is curable when caught at an early stage. And the only way you can catch cancer at an early stage is to screen. One of the things that can be done is what we are already doing, raising awareness for people to screen. So if we have many more bodies raising awareness so that people can know about cancer and they can go for screening. And there are some cancers like cervical CA that you can have vaccination for. That's you vaccinate, the adolescents, even the elderly people, that's the adults, following some screening. And then when they are vaccinated, their chances of having cervical cancer drops. In the West, that's the Western world, the cervical cancer incidence has dropped by 70%. And this was achieved just merely by screening, by vaccinating. So you vaccinate the children and they will not have cervical cancer because the human papilloma virus that causes it, you eliminate the chance of them being infected with it. So there are a lot that can be done from vaccination, screening to catch it early, then behavioral changes, just like you said. There are cancer, we have different type of cancer and there are different type of behaviors that can predispose to all this cancer. So if we know the different type of cancer, for example, cervical cancer, being faithful to your partner, such that there will be no transmission from other people, because if we have multiple sexual partners, for example, and your partner has multiple sexual partners, both of you are actually, having the experience of all the people you come in contact with. So that increases the chance of having human papilloma virus, and that also increases the chance of having cervical cancer. Then excessive alcohol intake, cigarettes, all this, they have carcinogenic factors that increase the chance of having cancer. And there are many other sedentary lifestyle, which is now what is more practiced because of white-collar job. Most of us have white-collar job, or you sit in the shop from morning till night. These are sedentary lives. Just mere exercise can reduce most of the cancers we have, the common cancers. Exercise can reduce breast cancer, can reduce prostate cancer, and many other. The intra-abdominal cancer, just exercise, it builds your immunity, and then balanced diet. Our food, our own local indigenous food, they have high fiber and they are not with many chemicals. But the fast food that we are now, moving to because of our busy schedule, they are high residue diets. They are diets that are stored, that are preserved with preservatives. And these preservatives, they also cause irritation in the system and predispose the system to cancer. And also the high residue diets also limit bowel movement. And this also predisposes to GIT, the gastrointestinal, mainly colon cancer. So there are a lot of habits that we are now practicing that predispose us to cancer. We are also more exposed to carcinogens from exhaust from cars, from generators. These days, every household, you have 4 or more generators from all the neighbors, and you sleep while inhaling the gas from this generator when there is no light. Or you are in the traffic and you have cars all over and you are inhaling the exhaust from the cars. All these are carcinogenic. So we need to improve a lot of things in order to close the gap to having cancer.
Absolutely. I mean, we cannot, overemphasize the importance of, early detection and screening. Yeah. You talked about the fact that you provide, you sponsor cancer treatment for indigents at Luth. What sort of treatment? And when you say sponsor, do you mean like, you partly pay for them, or do they have to bring some sort of insurance, or what sort of and who are these indigents you're talking about?
Okay. At NSI Luth Cancer Center, which is a partnership between Luth and NSI, we have the aspect, we call it NISP. There are some patients that will need radiotherapy, but radiotherapy is usually roughly about $1 million. So such patients, those who are indigent, that those who do not have enough, you can know them. We have a team, including a social worker, that is going to examine the patient to know what is the source of livelihood, where does the patient stay, and how much can the patient really afford. When the patient cannot afford enough, or even cannot afford at all, per month, we select some patients and we pay for their treatment. That will treat them free of charge. That's the kind of, and we do this in partnership with a few organizations who donate for us to pay for indigent patients.
Yeah, you also talked about enforcing insurance. I mean, it is very important, but how would that even work? Some people can't even make a decent livelihood as we speak. And I also, the cost of even just biopsy in different hospitals, I know it ranges from like 1.5 million and above. But I understand that the hospital in Ibadan, let me see, is it UCH? UCH Ibadan, for biopsy is about 45,000 naira for just, I mean, I think that's about the only hospital in Nigeria that you can get such, cheap care for cancer.
Biopsy just involves taking a sample, taking it to the lab to see if
absolutely, that's just an aspect of even just, the diagnosis alone is 1.5 million.
No, diagnosis is about 45. Just what you said is across, but it's about
diagnosis is 45. I'm talking about biopsy. Yeah, biopsy is 1.5 million in some hospitals. Yes.
Well, in some hospital, if you say some hospital, we cannot, that there is no, we cannot have a fixed amount across board because we have private hospital, we have government, but in government hospital, biopsy is about that.
45,000 naira.
Depending on what you want to do, it could be less. It could be less. When you take biopsy, it depends on what test you are looking for. So is it the basic test just to know if it is cancerous? Is it immunohistochemistry to know the type of cancer it is, or to know the origin, where it's coming from? Biopsy just means taking a sample. The biopsy itself is not the test. It's just the taking of samples. So there is histology, there is immunohistochemistry after taking the sample. So biopsy just means taking the sample. So it depends on the test you do with the sample. That's what determines the cost.
Yeah. Okay. Well, even these, sorry, Steve, I'm just asking because I have a few people that I've, been speaking with in terms of cancer. Even speaking about this insurance thing, what is the role of the insurance in terms of even hiking up the prices for care in hospitals? Because, I mean, if you were to get a HMO, for example, what's the monthly cost for that to start with?
It depends from HMO to HMO. But on average, the HMO, they pay on average less than what we charge the patient, because the HMO will have many more patients and they will have an agreement with you that they will bring many patients, so the price drops. So, on average. But I cannot say specifically for any HMO, but I just know generally HMO patients, they pay less, generally.
Okay. All right, I'm interested in the theme for this year. Together we challenge those in power.
Yes.
I'm interested in, what informed this and how you and those in the medical world will pursue that theme. I'm asking in relation to what you said about how you equipped the NSIA Luth Center is. That is, it has one of the best, equipment in Africa, south of the Sahara, except South Africa. What does South Africa have that we don't? And how do you think that speaking to power will change that narrative?
Okay. Now, South Africa has undergone development for a long time. We are trying to catch up. And unfortunately, our economy is not helping matters. However,
our economy is bigger than South Africa's.
Yeah, our economy is bigger than South Africa, but the population is also bigger, and our money is not as powerful as, so per capita income really is much less than that of South Africa. So we are equipping our facility. For example, in my center, we have 4 treatment machines. We have many other machines that assist it. But in South Africa, I've done some training in South Africa. In 2014, a center which I was, we had 8 machines there in South Africa. And trekking distance, not driving distance, we had 2 other facilities with two machines.
Where was that, in Joburg?
In Joburg, yes. That was specifically Witwatersrand. I was in Witwatersrand, and they had 8 machines as far back as 2014. But we, in 2019, we had the center with the highest machine, which is 4. Even though I can say today that our machine are far newer than what I met then in South Africa then, but we still have far less machine per.
How many do we have now?
We have 4 in my center. In the whole country, we don't have up to 20 machines. Whereas in Joburg, there are more than 20 machines, just in Joburg. But in the whole country, the functional machine in the whole country, there are no more than 10. That's functional. They are not more than 10. So we have, we don't have enough machine at all. And also, we are having a new challenge, the Japa syndrome. We are finding it difficult to see people to train, to work as oncologists today. And it's not just in oncology, it's across the medical field. All the trained people, before they finish training, they already do exam for either US, UK, or Canada, or Australia. So it's a very big problem too that we need to emphasize on, because medical doctors are not easy to get. And even when you get a new doctor, the experience, you won't have that in a fresh doctor. So we need to have concerted effort to stem this Japa syndrome. That's very important, because it also will assist in the management of cancer. So we are employing the government, more importantly, to equip the facility, to have maintenance agreement with the manufacturers of the facilities, because that's the only way we can continue running without having excessive breakdown. Also, health insurance, especially for cancer patients, because this is the only way we can foot bill of cancer patients, by collecting little and then using it for those, just like we do. Personally, I would rather pay for my own health insurance than to pay for my car insurance if I'm given the opportunity to choose. And I think that should be driven. If we can pay car insurance, there is no reason why we can't pay health insurance. There's no way it shouldn't be driven, so that we can have anywhere in the world where you have what looks like free treatment is because of insurance. It's not free. So I don't see why we can't do that. We should be able to replicate it and close the gap between access to cancer care, just like it is in the modern world.
Where does the National Hospital in Abuja, where does it stand in all this? What was its ranking as far as cancer care?
Well, as far as cancer care, National Hospital is highly ranked. Before the partnership between NSIA and Luth, National Hospital had the best facility then.
In Abuja?
In Abuja. But as of today, we have better facilities. We have more facilities. We have better facilities. There are some procedures that can only be done in our own facility in this country as of today.
I wanted to ask, actually, going off of that, where does the current the coordinating Minister of Health, Dr. Ali Pate, where does he stand in this? Is he one of the people who are speaking truth, speaking to power,
Power. If as a matter of fact, not long ago, he was at our center to see the center, to see how good, and I'm sure he gave us his promise for support that he will try as much as possible to have other centers to, be like this.
And do you think there's anything that he can do or people in government can do in terms of stemming this Japa syndrome that we've spoken about?
Well, one of the things government can do in terms of stemming Japa syndrome, I always say, if you have children, you treat them according to what they need. You don't have to, at a go, do the same for all of your children. You treat them according to needs. One of the things that needs to be done, apart from improving the facilities for operation, is to increase the pay, take home. If you have reasonable take home, if your take home is high, you yourself, you can improve on your surrounding. If I have enough take home, I can do some things for myself to make myself able to work well. It will not be that government will now have to do everything. Yeah. So I think the take home is one of the most important things that is causing Japa. When you just finish school and you go out and you realize that you can take 5 times what your professor that has been in the system for 25 years is taking, you don't have incentive to come back. You will want to stay there. But if you can make reasonable amount here, then you will consider all the cultural difference. And that will make you stay, and your ability to impact on your society is better here. No matter what you do over there, your society, you are not impacting much on it. So that will make you to be more patriotic.
Right. So stem the Japa syndrome, also enforce health insurance, as well as equip the hospital, which is very important. I'll just read out some statistics. Back in 2020, an estimated 78,000 Nigerians died as a result of cancer-related issues. Yes. And out of this number, 44,000 were females, while 34,000 were male. And which brings me to my question about prostate cancer, which is quite prevalent among, African men. And, studies have shown that, long care of, the prostate is, more beneficial than, surgery or some sort of, radiotherapy because of people that are, concerned about incontinence issues. What are your thoughts on that?
Long care. Mm-hmm. Well, statistics and clinical trials has shown that the conventional orthodox treatment is more, is better than other treatments.
Localized?
That's alternative.
You mean the
even
localized?
with localized.
Yeah.
What is there is that cancer, prostate cancer is a type of cancer that, depending on how aggressive it is, what we call grade. When you take the sample, you check how aggressive it is, then the age of the patient. So if we have an elderly person, an elderly man, for example, 75 years old, diagnosed with a low-grade cancer, that's an indolent cancer, we don't go and treat such a person. You do what we call watchful waiting. That's you monitor the patient. The reason is that the side effect of treatment may be too much for such a patient, because cancer, the indolent prostate cancer usually can be there for a long time. So we have those we do watchful waiting for, we monitor. Those we believe that the prostate cancer will not cause problem within the lifespan of the patient, you do watchful waiting. So, but if it is an aggressive form of prostate cancer in a young male, you know that because it's aggressive, it's going to create problem. Such one, that's where you have intervention. So actually, we have some subsets that we do that watchful waiting for, and we have the subset that you have to be actively treating.
All right, before we let you go, just a very quick one in a few seconds, doctor, if you don't mind. Is there any scientific basis to the things we read about that for men, one of the key things that is required in maintaining, in staving off prostate cancer will be the quality and intensity of your activity in the other room. Will that be medically correct?
That is medically incorrect. There are a lot of clinical trials that have, checked that, and we've seen that that has no effect. The predisposing factors for prostate cancer? One important factor is family history. We have some subsets that are familiar. In those cases, you will see that father had it, uncle had it, brother had it. Then men in that family must be very careful. They are likely going to have it because we have what we call BRCA2 gene that predispose some to it. Then age is the most important factor. If you are a man, the older you grow, the more the chance of having it. In fact, statistics from autopsy. Autopsy is what you do on dead, people. The research you do on dead people to see what's the cause of death. It's been found that for men that are up to 80 years, 80% of them have prostate cancer. However, only about 20% have aggressive form. So maybe just about 20 will have the symptoms while they are alive. The other 60% will not even have, will not even know they had it.
Benign or something.
Yes, not really benign. We have benign, which is BPH, which is another disease itself, but it's still malignant. It's cancerous, but like I said, it's indolent. It's not aggressive, so you don't need to treat. Those are the ones, if you diagnose them, you do watchful waiting. You don't need to treat.
So the key word here is that all those talk about activity has no medical basis.
There's fallacy. That's fallacy. There's no.
Thank you so much for educating Steve on that.
It's for the main world. It's for the entire world.
It's very sad that today on World Cancer Day, the president of Namibia, Gengok, lost his life to cancer in the early hours of today at age 82. So it really reminds us of the importance of what we're talking about today.
Absolutely.
Thank you very much, Doctor, for joining us.